News 8 presents Mental Health Matters, an exclusive town hall on kids in the digital age, sponsored by Connecticut Children's. Now, here are your hosts, Darren Kramer and Lisa Carberg.
Hi, everybody, and welcome to our News 8 special town hall.
As we enter year 3 of the pandemic, Connecticut's children are struggling. Mental health visits to the ER are up, grades are down. So what's being done for our children's futures?
All this to say, mental health matters.
They've lost their resilience.
Because I don't like being alone because I'm an only child. So I felt very isolated.
We have seen a sharp rise in the number of kids, particularly coming to our emergency room.
Unbelievable amount of anxiety, depression, eating disorders.
And it really made me very stressed and depressed and stuff.
It's very difficult just to reach out to people because you don't know who's going to understand.
It's unacceptable.
This has been a problem that's been ramping up now for a decade.
If it was more of an open topic, everyone would be able to be more accepting.
We begin with a first-hand account of what life is like for students as the pandemic continues.
The American Psychological Association says more than 80% of teens have experienced more intense stress during the COVID-19 pandemic. Joining us now are 4 high school students. Alexa is a senior, Juliana is a junior, and Sarah is a freshman.
They all go to Jonathan Law High School in Milford. Matt is a senior. He goes to Hartford Magnet Trinity College Academy. Thank you all for being with us. We appreciate it.
Thank you for having me.
All right, listen, let's start with this. How do you think the pandemic has affected your mental health? We know it's been tough. Alexa, tell us about that.
Personally, I feel like my mental health has just been impacted from all of last year being the option of being online or in school, or I go to 2 different high schools. So one would be fully online and the other one would be in person. So then you'd have the stress of having to deal with in-person learning with online learning, and just the combination of it all would impact you daily, saying if you can still do this and stuff like that.
The pandemic kind of turned everything upside down for me, as I've had mental health issues since I was around 9 years old, and the pandemic, just kind of being isolated, it really turned my anxiety and OCD and panic disorder just 10 times worse, and things became more severe. And just being so isolated and just feeling so alone and worried at the same time, it really just made everything 10 times worse for me.
School is tough normally, especially at this age, but the distance learning is so hard. What do you think this did to your academics, to the learning you should have done during this period?
It was very difficult for me, and I noticed a big drop in my grades from the beginning to then we went virtual, and then I stayed virtual. It was very difficult for me to find motivation and accomplish everything.
Sarah, let's ask you, did your school work, your learning struggle during this period?
Yeah, I struggled a lot because for me, I am a visual and verbal learner, and for me to just have to look at a screen for hours a day.
What do you guys think teachers, parents, and lawmakers could all do to help you more? Matt, you start.
I think as far as teachers and lawmakers, I think there needs to be more just resources for kids to go out and seek help.
I think that people really need to start prioritizing mental health, because last year they were very focused on grades and keeping your grades up, and they didn't really ask anyone how their mental health is or give many resources.
And we want to thank Alexa, Sarah, Juliana, and Matt for speaking up on this important topic.
Now that we have heard from the students, let's get now to our expert panel. Joining us tonight, the Division Chief of Pediatric Psychology at Connecticut Children's, Dr. Melissa Santos, is here. The Chair of the Connecticut Kids Care Network, Dr. Jennifer Schwab. Vice President of the Connecticut Education Association, Jocelyn Delancey.
And we also have School Counselor of the Year, Curtis Dara, Minority Leader and Ranking Member of the Committee on Children, State Senator Kevin Kelly, and the Co-Chair of Committee on Children, State Representative Liz Lenahan. Welcome to you all. Quick reminder, we've got a lot to go, so limited time. Please keep your responses concise. All right, let's start with the overarching issue, remote learning. The students we just spoke to say by learning from home, it affected everything from their grades, their social lives, and ultimately their emotional well-being. Dr. Santos, let's start with you. Overall, what changes have you seen in kids since started learning remote from home?
We've seen a huge change in kids since the start of the pandemic and the start of remote learning. Our kids said it best, and those kids said it the best too. Life's changed dramatically at the point that the pandemic started, remote learning started, and we've seen a sharp increase in that time in kids and families seeking mental health services throughout the whole time.
Curtis, as a school counselor, have you seen widespread change in student achievement since the start of remote learning?
Oh, yes, absolutely. We've been seeing a lot of dramatic changes with academics, pushes on curriculum, but not a lot of the supports for the mental health areas in the kids. A lot of increases with anxiety and depression, families trying to get it back together and getting back on the right track. So we here in Danbury are really focused on really trying to get those kids focused on the right track and working together with the teachers and the social emotional learning to be taking place back in schools. The kids need it. You can see it. There's a huge increase going on right now.
Representative Linehan, Governor Lamont was working under executive order during the pandemic. Knowing what we know about how it affected students, would you have wanted him to handle it differently?
You know, I think when it comes to school, kids in school and their mental health, hindsight really is 2020. And I really need to look at what we're doing moving forward. I don't think remote learning was the way to go. I think keeping kids in school is the utmost of importance, especially when most of our referrals to mental health services begin from the school setting. So I think that we're really more focused on looking forward and ensuring that we keep schools open for the rest of the time.
All right, Senator Kelly, how about you? Was there another alternative to closing schools in your view?
Well, I think as Representative Linehan said, in-person learning, there's no substitute. And I think when you look at what the effects have been and what we're seeing now, it demonstrates that was sorely missed. I think social isolation, whether it's here or in other areas, is not good for the human soul. And so it deprived the student of an actual hands-on learning, but it also dealt with the things such as intervention and interaction. And I think those were the things that were missing. And, now we're looking at this and making sure that we make changes going forward.
As we're dealing with this unprecedented time, I mean, what a couple of years. Jocelyn, let's talk about teachers and how they handle remote learning. My sister's a teacher. I know how hard this is. It's really tough that way, engaging kids and really get them to lock in and learn, right?
I mean, it absolutely is. I think, when you're in a classroom, you're face to face with students, you can really interact in a very specific way and an intentional way. When you're remote, there are certain limits to how you can access and engage students. And so being able to create dynamic and engaging content and lessons is much harder when you are when you're teaching remotely, especially when you look at the resources that are provided for certain teachers in certain districts. Coming from the district that I came from, we had so much technology prior to the pandemic. We were at an advantage to kind of play around with those tools and use them in meaningful ways. Many teachers had to work triple time to just figure out how to use the technology to do that. And so the intent of creating that was there, but the level of equity and how that was produced really depended on where you were and the access that you had. And so we all believe that in-person learning is best. Unfortunately, because of illness and other things, it really did hinder our ability to be in school. And so I think when we look at moving forward, the idea is, how do we stay in school and how do we meet kids where they are right now? That's the biggest worry for me. So what we do next.
All right, Dr. Schwab, you're a pediatrician. With kids being out of the classroom and being home, sometimes alone for extended periods of time, did that stunt any kind of social development? Because kids all have milestones, not just toddlers, right? Teenagers too.
I think the biggest thing about being a teenager is that it's your opportunity to grow.
and become independent from your parents. And they lost that. They lost that opportunity to really navigate the social world of hanging out with people from opposite genders, people of all different ages, and learning different perspectives. And they really suffered. And so it's been a real challenge to try and help build their resilience back and help them be, ready to face the world as we move forward. And so it's almost like they missed 2 years, just like we all did. Right. And then for some of them, I think school was safe. I have so many families where there's a parent struggling with mental health issues or addiction issues. And then to add financial stress from the pandemic on top of that, isolation, fear of getting sick or fear of hanging out with your friends and making your family sick. It was too much to put on their shoulders. And we heard from those students who spoke so beautifully and articulately about the stress that they felt. That's not what we want to hear our kids saying, is that they're that stressed.
Boy, that's true. Dr. Schwab, thank you. An unexpected symptom of this mental health crisis. One doctor reporting the spike in antidepressant prescriptions in young people, why they're turning to medication, and we'll ask if it's helping.
Plus, how can you tell if your child is struggling? Advice from our medical panel when we return. Stay with us. Welcome back to News 8's special town hall Mental Health Matters. During our special reporting this week, Dr. Jennifer Schwab, who is on our panel, opened up about how she's treating children. She says some days she's prescribing as many antidepressants as she is antibiotics. Prozac is FDA approved for kids 8 and up. Dr. Schwab, is medication helping these kids?
It is. Let's be honest. It's a holistic approach is what we need. So you really want to engage teachers, parents, the school system, therapists, and cognitive behavioral therapy is a really important part of the process. But as we know, and we'll hear later from our state representatives, access is a huge issue. 1 in 5 youth have a significantly impairing mental health diagnosis. And selective serotonin reuptake inhibitors, medicines like Prozac and Zoloft and Lexapro, are safe. They're FDA approved. And even when they're not used on label, there's a preponderance of safety data. They are safe, they save lives, and they really improve the quality of life for children so they can get back to school and to being with their friends and to feeling less sad and less anxious.
In December, the U.S. Surgeon General, Dr. Vivek Murthy, issued an advisory declaring a crisis with the mental health of kids in this country. That advisory is to alert parents and educators and policymakers of the real struggles kids are facing. He says 1 in 4 kids experience depressive symptoms during this pandemic. The CDC says mental health related visits to the ER were up 24% for kids ages 5 to 11 and 31% for kids ages 12 to 17. And suicide attempts were 51% higher for girls, 4% higher for boys. Dr. Santos, we know we've done stories on how Connecticut Children's was filled to capacity at points during this pandemic. What are the signs parents should look for if their child is struggling, and when do you know it's time you really should go and get some help?
Yeah, it's such a great question. So you know your child the best. So you want to be on the lookout for changes to how they normally are. So perhaps your normally very outgoing child seems to want to be in their room a lot more, or perhaps your normally quiet child seems to be even quieter. You want to look for changes in school performance, or they have changing in their friends groups. Those can all be signs to be on the lookout for. I would also encourage parents to really be on the lookout for physical changes as well. It's tough having big feelings in your bodies, and sometimes when you can't express them, you do express them through tummy aches and headaches and things like that. So also being on the lookout for those physical changes. We always say that the front line is always to start with your pediatrician or your schools. Those are who know your child the best. But if you're concerned about the safety of your child, you're concerned about the safety of somebody else because of your child really struggling with their mood or their behavior in that moment, you want to call mobile crisis at 211 to see if they can get someone out to help you at your home, or if they decide that you need to go to the emergency room at that point.
All right, thank you, Dr. Santos. Still to come, kids and masks. As the state gives the green light for the masks to come off, our student panel is sharing their concerns. We'll hear from them. First, though, the state legislature will start debate over new mental health legislation. We're going to break down the proposals and how they could help your child when we come back. Welcome back as we continue to highlight the mental health crisis in Connecticut's children. There is action being taken right now at the state capitol. And lawmakers are focusing specifically on this issue during the session. Debate will begin tomorrow in the Public Health and Children Committees on 2 bills. Let's bring in State Senator Kevin Kelly and State Representative Liz Linehan. Senator Kelly, what does the Senate Republican proposal look like?
Well, you know, the good news here is that all 4 caucuses are looking at mental health and addressing the issue. What we're looking at doing is to not only have short-term but also long-term goals. First and foremost, let's increase access Let's widen the bandwidth, if you will, so that anybody that is in need of services can find and get them. And that is not only actual, but also impediments to that access, like financial, insurance coverage, and the like. We also want to look at increasing the bandwidth of developing more services and individuals to go into this profession going forward. So we're going to look at things that will do that. But then also study things like, I'm going to say, looking at social media and its impact on youth, as well as just looking at mechanisms to make sure that if there are services attached, they remain attached, and that they transition from, let's say, a school-based environment into the community. So we have to look at this holistic, and that's what we're doing. I know a lot of other people are doing the same thing, and that's really what's heartening under the Capitol Dome, is that we all recognize there's an issue, we all have a response, and we're all working together.
Representative Linehan, same question to you here. What are the House Democrats focusing on in their child mental health proposal? Where's the overlap here, and where's your plan different?
Yeah, let's be very clear that Senator Kelly had a great point that all four caucuses are involved in this. The proposal in front of the Public Health and Children's Committees tomorrow is a bipartisan proposal. And I'm thrilled that I have Senator Kelly as my ranking member on my committee. And so we're all looking at this together. I think we overlap in a lot of different places. And ultimately, the bill that you're going to see passed is going to have elements in each proposal come together. And what we're looking at and what we're talking about tomorrow, in addition to all of those things that Senator Kelly spoke about, we're also looking at training for our pediatricians in the state so that they can better handle that first step when someone comes in with a mental health concern with their child. We're also talking about adding more school counselors, licensed clinical social workers, marriage and family counselors in the school setting. And we're actually looking to expand Access Mental Health, which is a service that right now is available for pediatricians as a consult service. And we want to open it up to families, because as the good doctor was saying, when we're talking about medications, there needs to be more guidance to parents, and we can actually have someone through Access Mental Health do that. So we're talking about expanding some of the programs that are already there. We're talking about creating new ones, and all of this comes down to essentially access, coverage, and affordability.
All good stuff. All right, let's bring in the rest of the panel now. Jocelyn, what do you think about these proposals? Will they do enough to help students and teachers navigate these challenges?
So I think we're really excited to see these on the table and to see a bipartisan approach, because we know how vital these resources for students and for teachers, because our goal is to support the children in our classrooms. And so we think that it's a really great start. We really want to make sure that getting those bodies and those the school psychologists, the social workers, and school counselors in schools with appropriate ratios, so that we can really work with those children and give them the time and care they need, and not be so spread out that we can't cover kids who really need it the most. And so I think that we're excited about it, and we think that there's a lot of room to put some really great tools for both students, families, and for teachers as well.
Dr. Santos, do you think these initiatives like increasing access to telehealth and expanding hospital services are enough? Do you think these proposals get at the root cause of the crisis? What do you think?
I think it's important to understand that we had a behavioral health crisis prior to the pandemic. The pandemic's really highlighted the problems we had with access to care, providing equitable care to all families. And I think if there's anything good that can come out of this pandemic, is that we can start creating sustainable solutions that are going to last a long time. And I commend our state legislators for really putting forth efforts to really do this. Is it going to be enough? It's more than what we have now. And I think that's critical when we think about how we truly create a continuum of care to help the emotional health of our kids, starting at the very youngest ages and in all settings that our kids are attending.
All right. When we come back, the final thoughts from the experts, and later we tackle the dangers of social media on children's mental health in our digital post show. last 30 minutes, we highlighted the children's mental health crisis, looked at ways parents can spot it, and possible solutions coming from our state lawmakers.
Yeah, we want to give everyone a chance to share some final thoughts now on this crisis. Before we switch over to our digital post show, you guys keep your responses brief. We have just a couple minutes left. We'll have more time when we go online. Curtis, let's start with you. Final thoughts.
Yeah, thank you so much. I mean, right now, caseloads in the state of Connecticut are over way 350. Right now, I have 375, and we need to really increase the school counselor ratio to 250 to 1 is the ASCA recommended ratio, just so all students can have access to a school counselors. We are the front lines to the community, the families, and overall the students. And those students need to have access to a comprehensive school counseling curriculum to really address the academic, social, emotional needs. And it's time to reset the bar, and this is the chance to do it.
All right, Dr. Santos.
What an opportunity we have right now to really completely revolutionize the way that we take care of emotional health. And I would say for parents, I know you're getting a lot of information about kids' mental health, and it's hard and it's overwhelming. Have the conversation with your child. You can't do it wrong. I know sometimes we worry if we bring up these hard topics with them, like depression or suicide, that it's going to put ideas in their heads. They're going to get information from lots of places. Let part of that be from you.
All right, Jocelyn.
I think we really need to take this opportunity to meet students and families and teachers where they are and reflect and grow from our lessons that we've learned and really use those lessons to move forward in a proactive, creative, and dynamic way for our schools and for our children and families.
All right, we have a link to resources on WTNH.com, but if you or someone you know is struggling, you can contact Connecticut Children's Care Coordination or the National Suicide Prevention Lifeline at 211. There is help 24/7.
Thank you for joining us tonight. We've got local news starting at 8 on WCTX.
But this conversation continues right now on WTNH.com. We invite you to join us there for our digital show.
Welcome to News 8's Mental Health Matters Town Hall Digital Post Show.
Hey, we're keeping the conversation going about the struggles Connecticut families, students have faced through the pandemic. Over the last half hour, we discussed things like remote learning and isolation affecting kids, but there's another big component, social media.
That is a big component. Yeah, earlier we asked our student panel how social media affected their mental health through this pandemic. Listen to what they had to say, starting with Matt, who's a senior.
Me personally, when the pandemic hit, I deleted all my social media accounts because I didn't want, a lot of the stuff on there was just negative. There was nothing really positive going on. So I deleted my social media account. I still haven't reactivated it. And I just thought it was not beneficial during the pandemic, just for our mental health.
Matt, what kind of stuff were you seeing on social media that bothered you during this?
Just a lot of negative things, and like a lot of things that would worry me, just like COVID facts and just things that I was trying to escape from just kept reappearing through social media.
I was on social media a lot this pandemic. It actually was a helpful thing for me. And it was like a good distraction from like all the isolation and like terrible news and everything going on in the world. And it helped me learn a lot of things throughout the pandemic too. I took on new hobbies because of social media, like seeing people baking. I started to bake too. Yeah, so it was positive for me.
Sarah, what about you? Did social media help you or hurt you during this?
It helped me and hurt me because social media helped me as well. Like, it was like a distraction from all of like the COVID stuff, and seeing the news every single day and like COVID cases rising, it scared me a lot. So I would go on social media just to like de-stress, but I started relying on it too much to the point where like I was like, okay, I need to stop, and I deleted my social media after that.
All right, Alexa, how about you? Tell us about your experiences.
For me personally, I feel like it was a positive and a negative side. So when like COVID first started, I realized it was like the friends or family that I get to see regularly, and like now nothing because of the pandemic. I was able to like reach out to them and like actually communicate and talk with some of them more than I would normally. But at the same time, it was hurtful because I'd be on it sometimes just to like, because I was tired of doing schoolwork so much, or like going from like a computer screen to a phone screen wasn't so good for me. So I had to stop social media at all aspects. And so I deleted a few of my accounts. But then when I did get back was like Instagram, where I started looking into more college stuff. So like it helped me with colleges, but at the same time it hurt me with like trying to stay focused in school and stuff like that.
And let's bring back our expert panel right now.
If you're just catching us on digital, pardon me, we will reintroduce these folks. The Division Chief of Pediatric Psychology at Connecticut Children's, Dr. Melissa Santos, is here. The Chair of the Connecticut Kids Care Network, Dr. Jennifer Schwab. Vice President of the Connecticut Education Association, Jocelyn Delancey.
Here we also have the School Counselor of the Year, Curtis Dara, Minority Leader and Ranking Member on the Committee on Children, State Senator Kevin Kelly, and the Co-Chair on the Committee on Children, State Representative Liz Linehan.
Okay, now that we're on digital, you can take a little longer with your answers if you like. Folks, we want to hear from each of you now about how pervasive you think social media has become in the lives of kids.
Connecticut's Attorney General William Tong has launched an investigation into social media platforms. This after the Facebook papers were published last year. A whistleblower leaked thousands of internal documents from Facebook that proved the company knew the effects on products had on young people.
And the most serious cases, kids have died by suicide because of their addiction to social media. A local family suing Instagram after their 11-year-old daughter took her own life. She became depressed after they say she was preyed upon by adults and was bullied online. They say attempts to control her addiction resulted in her turning violent when they took her phone away. Dr. Santos, let's start with you here. What kind of psychological effects does it have on kids that you've seen, and how can parents help their kids navigate this new digital world?
I have to say the kids that you had in this segment are so well spoken, and I think they spoke so clearly to the double-edged sword that is social media. There are many negatives that people will talk about when it comes to social media, but there are also many positive that kids will talk about. They'll talk about the increased connection, how they feel connected to their friends. In the time of the pandemic, for many of them, social media was the only way that they felt connected. But I think for kids that are prone to depression, that are prone for anxiety, they'll see things on social media and they'll interpret it in a certain way, and it gets to be really hard. I think they'll see things and they're like, well, why don't I have that? Or, maybe I should try that. Or why isn't that happening to me? Or why are all my friends out at places and I don't get to go to those sort of things? And I think it's really tough in that way. I don't know that that banning per se is the way to do it. I think when we tell kids they can't do something, I think it becomes even more appealing to them. But I think it speaks to the importance of setting rules and guidelines around social media. Let's face it, we all need to cut down on our social media, kids, adolescents, maybe all of us that are here today. And I think kind of having those conversations with kids about, what do you like to go on? What do you go on? What are the apps that you use? And what are you getting from them is how we start the conversations for what kids are really trying to get from social media and how we can really help fill those needs that they're getting from there in other ways.
All right, Dr. Schwab, when you're talking to your patients and prescribing antidepressants, are any of them mentioning social media as a contributing factor to their unhappiness? And what's your advice to parents?
It's interesting. I don't think that a lot of our patients are that cognizant of what it is doing to them. It's keeping them up late at night, which is impacting their sleep, and sleep deprivation can lead to anxiety and depression. We know excessive screen use can lead to anxiety and depression. That fear of missing out is very real, and seeing other people. So I think the hardest thing, honestly, is that we as parents need to start setting limits for ourselves and lead by example, and starting, honestly, take home message tonight, have family dinners together without screens. Be curious, ask your kids what they're doing on social media, ask them about their friends. I ask my teenagers, where does your cell phone sleep? And they all look at me and laugh, but a lot of them sleep with that phone under their pillow. And I try and encourage them to put it in the kitchen. You don't need your phone with you 24/7, and taking a break and re-engaging in healthier activities like exercise, like eating healthy foods, like getting enough sleep are just as important as the antidepressants.
Curtis, you're on the front lines of all this. Are more kids coming to you now with more concerns about things like cyberbullying or the negative experiences on social media? What are you seeing?
It's interesting you say that. I've just been dealing with that for the past 2 weeks. So probably a lot of what is the biggest issues would be Snapchat and TikTok. We saw in the very beginning of the year these TikTok challenges that were a lot of kids were influences to destroy bathrooms. There were even some threats that were among teachers for challenges for kids to kind of do. And so a lot of kids will hide behind a screen. And what we're seeing is insane amount of meanness, insane amounts of bullying that a lot of kids think that it's okay to say. And I think a lot of that has to do with the pandemic, as for about 19 months before schools started opening up, is that a lot of kids found that that was their go-to and that was their outlet. And so coming back to schools, they didn't realize, oh, I don't know, I can't say that. And no, you can't say those things in school, and you can't say those things on a computer. So it's a lot about reteaching and putting a lot of social and emotional learning when it comes to teaching these kids. And so as school counselors, these are the things that we do when we do these pushing lessons for our kids, and also bringing them in and reteaching about restorative justice and how can we repair these friendships, because a lot of these things they don't really mean to say, but they are saying. They don't realizing the impact of the emotional stress that's causing, especially when everything is ranked by a number or how many likes that they have.
All right, Jocelyn, has social media affected classroom behavior at all? Or have you seen, or has it made it more difficult for teachers to keep kids' attention?
So I'm a fifth grade teacher, so it's a little different for my students because they're kind of at the cusp of being exposed to social media and not. But it is definitely a distraction, especially when you have kids who have access to a phone, who can look at it throughout the school day, who really feel dependent on that lifeline for some of them. It's like, if I'm not involved in the social media comings and goings of my group or my school, then I'm left out or I'm not involved. And so it definitely impacts behaviors on so many levels because there's a distraction. There's the anxiety of fitting in and being a part of it. If there's bullying going on, which we know that there is, that's a fear that some children see at night when they look at something and then come to school worried about how that's going to impact their day. And so their access to being available to learn is so much less because they have all of those things on their mind, and academics are second to that because their emotional well-being needs to come first.
Representative Linehan, we know you folks have a full plate this session, but does the state legislature plan on addressing social media concerns at all during this session?
We absolutely do. And there are a few bills in front of our committee now that take a look at that as to whether or not Connecticut can require a parent's approval to have a social media account, to kind of go one step further above federal law. And, we've been really focused, the Committee on Children itself has been focused on this issue for years. It's really nothing new for us, because we've been screaming at the top of our lungs for as long as we can, hoping that we can provide information for parents. And so the committee, in addition to doing legislation, we've also done a series of roundtables and some videos. And I just want to kind of echo what Dr. Schwab said. I'm a parent before I'm a legislator, and I have a 13-year-old. And so social media was a really big problem. And then we also were concerned during the pandemic, when they were spending so much time in the room on the internet, going upstairs, closing the door, and then who are they talking to? And are they talking to adults? Are they, being asked to? I had one constituent who was asked as an 11-year-old to make a video for a grown adult that was inappropriate. And then that child was threatened that they would come and kill their father if they didn't do this. And so it became a topic in our house to talk about all these things. And I just wanted to say really quickly, we have made the decision to put our phones away. It's difficult as a legislator. I am always in contact with my constituents, but I realized, just like Dr. Schwab said, I needed to mirror that or model that behavior. And instead, what we now use at the dinner table are a series of question cards that spur conversation between us and our kids. And now it's no longer having your phone in front of you while you're eating your dinner and scrolling through. That's the favorite part. It's the conversation starters. So it's really Marshall's $9.99. I would suggest any parent who's having trouble talking to their kids about these things to get them away from their phones and engage them in conversation. There are some really good conversation starter boxes out there, so you can have an easier time talking to your kid.
Okay, Senator Kelly, how do state Republicans want to handle social media? Is it a priority for your caucus?
Oh, definitely. I think when you look at this, and you've heard individuals talk, social media is a double-edged sword. It has positives. You can reconnect. You don't have to travel. There's a lot of things that are benefits, but with the benefits, there's also things that are negatives, and we've heard a lot of that. And so what we want to do, one of our initiatives, is to look at social media impact and to study that, and to look at this and to weigh the pros and cons, just like we're doing here, and have, I'm going to say, task the University of Connecticut to study this issue and to report back so that we can then move forward with data and make sure that what we do is enact good, efficient policy that's going to protect our families and our kids.
Another hot topic that's kind of rolled into this mental health issue is masking in our state. The governor is now allowing schools to get rid of masks starting next week. Not every school in the state is going to do it, but the kids in our panel have some concerns about it. Listen to some of what they had to say.
I'm personally upset about it. I wish that they had looked more at their rates and stuff. And took science into account and not just listen to the students that don't want masks. And I'm kind of uncertain about how they came about this decision.
I think that the option to wear a mask and to not wear a mask, I don't agree with it, because wearing the mask isn't going to hurt anyone. So I don't think that anyone should be unhappy about it.
A lot of kids are very excited to get rid of masks, too. All right, so after hearing from these concerned citizens, is this the right time to get rid of the mask requirement? Senator Kelly, let's start with you.
Well, once again, Hartford, should look toward the local. We believe as Republicans that the local government, the government closest to the people, is the best government to be making decisions for their citizens. And so once again, looking to the local school boards to evaluate what their school system has, the resources that are available, the students and their needs, and make decisions in that manner.
Representative Linehan, same to you. Do you think this is the time now to do away with masks, or are the concerns of those kids we heard from founded? What do you think?
Yeah, I personally and professionally believe that it's time to unmask, but I don't think that it's necessarily because it's a local decision. I believe it's because it's a decision based in science. And whoever's going to make that decision is, as long as it's based on science, I think it's appropriate. However, when we listen to the kids at the opening of this segment, they're expressing concerns. And we know, just based on anecdotal evidence, that mostly the kids who are voicing that they can't stand the masks are really echoing things that they hear at home. And there are still a lot of kids who have concerns. So I think that it is incumbent upon us as the adults to say, we are making these decisions with your best interest in mind, and explain to them why the decisions were made and show how the numbers are going down. I think that you have to give kids credit that they can understand when we explain it to them using facts. And ultimately, as state representative and chair of the Committee on Children, I'm putting together a Zoom right now that would have a mental health professional talk directly to those kids who are concerned. We need to work not only with the parents and the kids who want to take the masks off, but we need to hear the concerns of those kids who say, I don't know if we're ready yet. I don't know when we should be ready. And I don't know if I trust the adults.
All right, Dr. Santos, your thoughts on this topic?
I think decisions about masking have to be based in science. I think, as we've talked about, it's been interesting since the start of the pandemic, here at the hospital where we require masking for everyone. It has not been kids who have been struggling with the masks, or that we have to remind that masks go over the nose or anything like that. It tends to be the grownups that have been struggling. I give kids a lot of credit during this pandemic. They have really stood up and really taken the charge to help one another to heart. And I think that's what you're seeing in terms of some of the concerns about unmasking, is whether or not it's the right time or whether or not they're putting people at risk. You have to remember, kids have lost a lot of grown-ups in their lives during this pandemic. This is a trauma that they will be having for a long time. And I think it's perhaps where you're seeing some of the additional concerns about unmasking at this time for them.
Yeah, Dr. Schwab, are you seeing any of your patients concerned over taking masks off? And if so, what do you tell them and their parents?
Vaccination, get vaccinated. And I think that's my biggest fear for the elementary school kids. The good news is most kids do fine with COVID, but I hate that they get quarantined. Now there's more of a screen and stay protocol. And so it does mean that more kids are going to get sick, and rarely they get really, really, really sick. So get the vaccine. We know the vaccine is safe, is my best advice. And that, yes, trust the science, trust to know that the cases are dropping, and we wouldn't be taking the masks away if we felt like your life was in danger, and sending that message of safety.
All right, Jocelyn, teachers have been outspoken about keeping masks on in schools. Does that feeling still prevail?
So I think CEA's stance has always been to follow the science. That's where we were. And when we were at cases of, rates at over 20%, we were very worried about the mitigation strategies and making sure that we had healthy teachers in classrooms. I think at this point, with the vaccination rate that we have very high teacher vaccination rate. We have, a lot of the mitigation strategies allowed for us to stay in school. Back in January, we just had so many teachers who were sick that they could not be in school. And so I think that was not because they didn't want to be, or they were, trying to fight something. It was because they were ill and could not be there for students. And we know that in-person teaching is best. We know that the teachers who are trained and who are have successful relationships with those children since September all the way to now are the ones we want in front of our classrooms. We have a sub shortage, so we need to make sure that our teachers stay in school safely. I think if science is saying this is the time, it was getting warmer, now it's not, but we can open windows. We know we have ventilation issues, that precede the pandemic, but we think that if our Department of Health is saying it is a safe time to do that, then we're going to stand by that, making sure our biggest concern is how children who choose to mask and teachers who choose to mask and who don't, how they're treated, and making sure that we are compassionate and kind and supportive of whatever that mask choice is. And I think some of the fear from the students is, if I choose to wear a mask to keep my family safe, am I going to be safe in school socially and emotionally, and vice versa? And I think that's where some of the concern is. And one of the reasons why we appreciated the mandate was because it kept things consistent so that everybody had the same charge. And now it's just going to be a little bit more complicated to care for and manage that option with masking. So that's where our concern is right now. But we go with the science.
Curtis, how about at your school? How are the kids reacting to this option of dropping the masks?
So here in Danbury, it is pretty 50-50. So, like, I have to echo a lot of what my panelists have also said here. If kids want or are going to have the option to wear a mask, then they're going to have the option to wear a mask. And for those who don't want to, they're going to have the option of not wanting to either. I definitely believe in the vaccine, and a lot of, for people who are ready for this, we're coming on 2 years, right? March 10th is when I know that Danbury Public Schools close. So, I think a lot of kids really just want that like normalcy, and they're craving that past school year. Remember, our current 8th graders right now haven't had a real normal school year when they were in 5th grade. So they never really had a really middle school year. Our 7th graders were in 5th grade, and our 6th graders were in 3rd. And, so it's a lot of adjustment to really growing up, and 7th grade hormones and puberty really strikes in middle school. So there's really struggling with a lot of how they feel, and a lot of that meanness is kind of really coming out. And so I would say that my biggest concern right now is if the kids do choose to wear a mask, and we need to really create that kind and compassionate environment, just like Jocelyn said, and that school culture of just really respecting each other's their family history or whatever that they experienced during this pandemic. And I always say to kids, have courage and be kind. That's all really we can do as humanity and as a school in our community.
Well said. What a 2 years it has been. I'll tell you, we want to thank our panel tonight. Thank you all for your time. Great conversation, searching for solutions to help fight the children's mental health crisis.
And for details on resources and other stories on mental health, head to WTNH.com or the News 8 app. Thanks for joining us. Great conversation. Good night.
Good night.
For a little late day clearing. Temperatures today are going to be in the 20s.
Hello. Mic check, 1, 2, 3. Mic check, 7. Hi. What are you doing in the 8?
Hello.
Hi.
Nobody's answering.
Oh, nice.
Say. No, we don't.
Stacy, do you hear me?